welcome to my presentation. My name is Dr. Taylor Larsen, and today I'm presenting a review on eating disorder prevention and prevention protocols for elite female athletes. Here's a little about me. I'm an alumni for the University of Arizona Global Campus. I received my doctorate in sport and performance psychology. My career aspiration is to assist in lowering the prevalence, incidence, and death rate of those struggling with mental health disorders as well as eating disorders. I currently own my own private practice and I am a mental health counselor who specializes in trauma, eating disorders, and PTSD. This presentation will provide an overview of current research on athlete eating disorder prevention interventions and identify the gap in research regarding sports psychology preventative interventions. It'll also examine findings from this research project, as well as review research implications and discuss recommendations for future research. Studies indicate elite female athletes are at a high risk of developing eating disorders compared to male athletes, all gender non-athletes, and all gender recreational athletes. Elite female athletes competing in aesthetic sports are at the highest risk overall due to the pressure of obtaining and maintaining leanness at any cost. Over 1/3 of Division I NCAA female athletes are at risk for the deadliest mental illness, anorexia nervosa. And up to 62% of elite female athletes involved in weight class or aesthetic sports are affected by eating disorders. Eating disorders are considered the deadliest of all mental illnesses. Therefore, prevention is crucial for this extremely high-risk population. The purpose of this research was to synthesize and analyze current literature related to sports psychology, eating disorder preventative interventions for female elite athletes. Also to highlight a gap in literature, promote future research, and to use the study's implications to create an educational pamphlet for coaches and athletes. This project is extremely important because the high prevalence rates and the high risk factors that athletes have, it brings a need for sports psychology preventative intervention. There's a need to fill in a gap by providing sports psychologists with best practice recommendations. Also, the study may assist in lowering the number of athletes diagnosed with eating disorders, lower the number of athletes needing treatment, and prevent athletes from deteriorating performance, having health concerns, and potentially leading to death. The study focused on answering the following research questions. Which eating disorder prevention interventions have been most effective for sports psychologists working with the athletic population, and why? And lastly, what are best practice recommendations for sports psychologists to prevent eating disorders within the athletic population, particularly with respect to elite female athletes? The method of answering these questions was a systematic literature review following PRISMA protocols. Answering the project's research questions could lower the number of athletes diagnosed with eating disorders, decrease the number of athletes needing treatment, and prevent athletes from deteriorating their health performance, and it may even lower female athletes' fatality rates. After reviewing the current literature, the following gaps in research were identified. There are various studies focusing on sports psychology treatment, but there is a gap in research focusing on prevention of eating disorders among elite female athletes. There's also a gap regarding what sports psychology best practices are recommended for athletes at risk for developing an eating disorder. And there is an overall gap due to the limited research on elite female athletes. A thematic analysis was conducted after following PRISMA protocols for the systematic literature review. The results identified 5 themes that were categorized into 2 different categories: protocolized and non-protocolized interventions. Please note, protocolized interventions are very specific formal interventions with a set of rules and procedures that must be followed during the course of treatment. Non-protocolized interventions are interventions that do not require the facilitator to follow specific formal interventions, and it allows for more freedom to address a client's needs. The results of this systematic literature review indicated all 4 protocolized interventions were effective in lowering the prevalence rates, but the studies did not indicate the efficacy levels of each prevention intervention. I'd like to discuss the themes identified during this study. Please note, only sports psychologists that are trained in the specific protocolized intervention can facilitate the intervention. The first protocolized intervention is the athlete-modified cognitive dissonance-based intervention. This intervention is going to create psychological discomfort to motivate an individual to reduce cognitive discord by changing their beliefs. A sports psychologist will do this by creating an environment in which an athlete will become motivated to no longer idolize an unhealthy sociocultural ideal. The next theme is the athlete-modified healthy weight prevention intervention. This intervention believes that the more educated the athletes are on healthy weight for their best performance, the less likely they are to idolize a thin athlete ideal. This can lead to athletes making less dramatic changes to their weight and diet, as they're aware that this deters them from reaching their peak performance body ideal. The next intervention is the Victory Program. This is a specialized program that focuses on athlete-specific eating disorder risks and concerns. The treatment program is specified for gender, sport type, and sport level of competition. The program takes a multidisciplinary approach and includes several professionals who work alongside with athletes, including medical professionals, sports psychologists, sport dietitians, strength and conditioning coaches, and specific specialized eating disorder therapists. The last protocolized prevention intervention is the Athena program. This is a program that is group-oriented and athlete-centered. It's to prevent female athletes from obtaining eating disorder issues and disordered eating, as well as body-shaping drug use, such as steroids and diet pills. The curriculum specifically targets modifiable risk and protective factors related to eating disorders. The non-protocolized prevention intervention was prevention education. Prevention education is believed to be the most crucial part of eating disorder prevention among female athletes. It focuses on providing athletes, coaching staff, and other multidisciplinary staff with basic education on diet, nutrition, exercise, and weight ideals for their sports. This intervention is based on the belief that the more athletes, coaches, and staff are educated on what diet and body type make peak performance, the less likely they are to make drastic changes to enhance their performance. These prevention education programs can be conducted by a sports psychologist, coaching staff member, or an elite female athlete peer. General prevention is usually written in a way that athletes and coaches can understand, rather than from a psychologist's perspective. Therefore, the information is direct, clear, and basic. The results from the studies can indicate options for sports psychology best practice recommendations. However, further research indicating the levels of efficacy for each protocolized intervention should be conducted in order to determine the most effective interventions. The non-protocolized findings from the study were integrated and utilized to create an educational pamphlet. The pamphlet is proposed as a low-cost and easily accessible medium to promote the sharing of evidence-based knowledge and resources for best practices for preventing eating disorders among elite female athletes. It provides coaching staff and athletes education on their role in prevention, discusses risk factors for athletes, highlights the warning signs of an eating disorder, and it reviews how to intervene. It also provides overall tips for coaches and athletes and includes a national prevention resource for athletes. There are several recommendations for future research. The first is that more research should be conducted on elite female athletes as the number of studies are limited. The next is additional research on the efficacy of prevention interventions may assist in determining which interventions are most effective. Also, future research should focus on determining if prevention interventions are sport-specific, as this can be helpful in sports psychologists determining which intervention is most appropriate for sport-specific athletes. Next, longitudinal effects of prevention should be studied to determine the prevention intervention's length of effectiveness. And lastly, most of the research on elite female athletes are focused on white females. Therefore, research on male and marginalized athletes could be helpful in determining if interventions can be generalized across all populations of athletes. I'd like to take this time to thank you for this opportunity to discuss my research topic. If you have any questions, please feel free to email me at the email address below.